In this video, we discuss bone-within-bone appearance due to endosteal new bone formation. This is a descriptive term applied to bones that appear to have another bone within them. 1. Normal. A. Thoracic and lumbar vertebrae among neonates and infants. B. Growth recovery lines after infancy. 2. Infantile cortical hyperostosis, CAFI. 3. Sickle cell disease, thalassemia, and Gaucher disease. 4. Chronic osteomyelitis including congenital syphilis, or TB. 5. Abnormal bone metabolism due to osteopetrosis, acylosis, acromegaly, hypothyroidism, hypoparathyroidism, and Paget disease of bone. Acromegaly. 6. Radiation. 7. Disordered bone growth due to heavy metal poisoning by bismuth, lead, thorium, hypervitaminosis D, thorotrust, ghost vertebrae, ionizing radiation. 8. Subcortical osteopenia due to leukemia, metastases, complex regional pain syndrome, or Sudeck atrophy and idiopathic juvenile osteoporosis. 9. Iatrogenic causes include bone graft, subcortical bone cement, bisphosphonates.
If you like the video, you can like it, comment it, and share it with your friends. If you are not subscribed yet, please subscribe and click the bell button.